Hey everyone, this is a short presentation on tuberculosis. My name is Jenny Womack and I'm a student at the University of Texas at Arlington College of Nursing, and this is in partial fulfillment of my Nursing Pathology for Educators course in 5318 for Professor Grande. Imagine a nurse on your unit has a bad cough and for months now has been complaining, but she's dismissing it as allergies and bad air quality in the hospital. But on her annual employee health evaluation, her TB skin test shows positive, and now, after months of coughing, her chest x-ray and sputum laboratory cultures confirm a diagnosis of tuberculosis. Both coworkers and patients were exposed, and now everyone is worried. Did my family get TB? Could I possibly have tuberculosis? So this is an important topic for us as healthcare workers and educators because tuberculosis is something that could affect us all. A little bit of background about tuberculosis is tuberculosis was the leading cause of death in the U.S. in the early 20th century. According to Palmer, due to medical and public health initiatives, there has been a steady decrease in tuberculosis cases until 1990. In 1990, there was a resurgence. In 2015, there were confirmed 9,557 cases, with 350 cases confirmed of healthcare workers. So some things that we need to look for, signs and symptoms of tuberculosis include a bad cough lasting 3 weeks or more, chest pain, coughing up blood or sputum, weakness, fatigue, weight loss, appetite changes or no appetite, chills, fever, and the classic night sweats. One thing about tuberculosis that we need to remember is transmission. Transmission of tuberculosis is most commonly spread from person to person through the air. When a person talks, coughs, sings, sneezes, tiny particles containing the microbacterium tuberculosis are put into the air. These particles, called droplets, ultimately spread the disease. So a little bit of pathology about tuberculosis. According to our textbook, Hall 2016, tuberculosis is a tubercle bacteria that has a particle tendency to attack the lungs. This microbacterium tuberculosis uses macrophages to invade the tissues and walls off lesions of fibrous tissue, creating a tubercle. Infection most often occurs when these tiny tubercle bacteria reach the alveoli of the lungs. Tuberculosis disease is most likely to develop in the apex of the lungs, but can also spread to the kidneys, brain, and bone. Tuberculosis bacteria can also spread through the lymphatic channels to the lymph nodes. So that stuff is important. So treatment, as far as treatment goes, I've lost my treatment. There it is. The CDC recommends 4 different types of treatment regimens for tuberculosis infections. These 4 regimens include the drugs called isoniazid, rifadentine, and rifampin. Providers usually choose the appropriate drug based on if they know the source of the tuberculosis or drug susceptibility, coexisting medical illnesses of the patient or person affected, and their potential drug interactions. Treatment can last up to 6 to 9 months depending on the type of infection, latent infections, and then if there's pregnancy or other risk factors can take longer to treat. Fortunately, with everything, expected outcomes are really good and tuberculosis can be effectively treated. Thank you so much for your feedback, and hopefully this wasn't too awful. I appreciate your paying attention. Bye.